So for hair loss, an excellent mixture for hair loss would be probably 1/4 cup of coconut oil and 1/4 cup of the castor oil, and then rosemary. So with the rosemary essential oil, you're probably looking at about 6 drops. And what the person does is they massage that into their scalp, tie it up in a knot, and try and leave that all day. Someone said, "Can I sleep with it?" Well, sure. You can sleep with it. And then when it's washed out, be very cautious on the shampoo you use.
Did you know that over 70% of chronic diseases could be reversed through diet alone? In a shocking breakthrough, Dr. Barbara O'Neill unveils her revolutionary protocol that challenges everything you thought you knew about nutrition and health. Forget conventional treatments. This game-changing approach empowers you to take control of your wellness by simply changing what's on your plate. Join the movement to reclaim your health and discover the incredible potential of food as medicine. Dr. Barbara O'Neill emphasizes that dietary choices significantly influence disease progression, particularly in chronic conditions such as diabetes, cardiovascular disease, and cancer. She highlights the role of inflammation, asserting that a diet rich in processed foods, sugars, and unhealthy fats causes inflammatory responses, thereby accelerating disease development. Conversely, a plant-based diet, abundant in fruits, vegetables, whole grains, and healthy fats, provides essential nutrients that help reduce inflammation and support immune function. O'Neill also points to specific compounds, such as antioxidants and phytochemicals, found in natural foods, which can neutralize free radicals and reduce oxidative stress, a key factor in chronic disease progression. Research shows that those who follow Mediterranean and DASH diets experience lower rates of heart disease and improved metabolic health. Moreover, she discusses the gut microbiome's pivotal role in health, asserting that a fiber-rich diet fosters beneficial bacteria, which in turn enhances nutrient absorption and immune response, while a poor diet can lead to dysbiosis and increased disease risk. The body's pH also plays a crucial role in maintaining health and facilitating disease reversal. The body operates optimally at a slightly alkaline pH, typically around 7.35 to 7.45. Deviations from this range can lead to significant health issues.
So the acid scale, it's 0, alkaline, it's 14, and in the middle, 7 is neutral. Blood has a reading on the pH scale, and blood's reading on the pH scale is between 7.35 and 7.4. It will always be within that range. If blood pH does go up to 8, that person will go into a coma and die of alkalosis. If blood pH drops down to 7.22, that person will go into a coma and die of acidosis. So there cannot be much variation there, and we don't need to worry about the pH of our blood because there are 2 organs that are constantly keeping it within that range.
Acidic conditions within the body, often resulting from poor diet, stress, and environmental toxins, can create an environment conducive to disease proliferation, including cancer, osteoporosis, and cardiovascular disorders. O'Neill points out that the typical Western diet, rich in processed foods, sugars, and animal proteins, tends to promote acidity, leading to systemic inflammation. On the contrary, alkaline-promoting foods such as fruits, vegetables, nuts, and seeds help restore pH balance. O'Neill advocates for monitoring and adjusting dietary habits to include more alkaline foods, enhancing cellular function and immune response. She also highlights the role of hydration in pH management. Alkaline water can aid in detoxification and pH normalization. Regular exercise and stress reduction techniques, like mindfulness and deep breathing, further support the body's ability to maintain an optimal pH level. If that's not all, the alkaline environment in the body is a potential strategy for combating cancer. According to Dr. O'Neill's research, cancer cells thrive in acidic conditions, leading to the hypothesis that elevating the body's pH level could inhibit tumor growth. O'Neill explains that maintaining an alkaline state involves a diet rich in fruits, vegetables, nuts, and whole grains, which promote alkalinity through their mineral content and metabolic processes. Dietary antioxidants help in neutralizing free radicals and reduce oxidative stress, potentially lowering cancer risk. Additionally, she also talks about the importance of hydration, suggesting that alkaline water can further assist in maintaining optimal pH levels and flushing out toxins. Apart from these, lifestyle factors, including regular physical activity and stress management, also contribute to overall pH balance. Studies indicate that cancer therapies may be more effective in alkaline environments, underscoring the need for integrative approaches that combine dietary changes with conventional treatments to enhance patient outcomes. Dr. Barbara O'Neill highlights a remarkable case of a 57-year-old woman who successfully avoided dialysis through significant dietary modifications. This illustrates the profound impact nutrition can have on kidney health. This woman, facing advanced chronic kidney disease, CKD, adopted a plant-based diet rich in whole foods, including fruits, vegetables, whole grains, and legumes, while eliminating processed foods high in sodium, sugars, and unhealthy fats. By reducing her protein intake, particularly animal protein, she decreased the metabolic burden on her kidneys, allowing for improved renal function. She also monitored potassium and phosphorus levels, crucial in CKD management, as excessive amounts can cause kidney issues. Hydration played a vital role. She focused on adequate water intake to facilitate detoxification processes. Regular physical activity complemented her dietary changes, enhancing her overall health and resilience. Additionally, she integrated mindfulness practices to manage stress, recognizing its adverse effects on bodily functions, including kidney performance. This multifaceted approach not only halted disease progression, but also improved her quality of life, demonstrating the power of lifestyle interventions in chronic disease management. After that comes medicine. Of course, it's not traditional medicines, but herbs, as Dr. O'Neill recommends. Certain common herbs can significantly support kidney health through their diuretic, anti-inflammatory, and antioxidant properties. Celery seed, rich in antioxidants and flavonoids, promotes urine production, aiding in the elimination of toxins and excess sodium, which can help manage blood pressure and reduce kidney strain. It contains compounds like apigenin, known for its anti-inflammatory effects, which can reduce kidney inflammation. Parsley is another potent herb containing high levels of vitamin K, vitamin C, and essential oils that contribute to its diuretic properties. The presence of compounds like myristicin and apiol enhances kidney function by promoting fluid balance and detoxification, while its antioxidants protect kidney tissues from oxidative stress. Kutch grass, or Eragrostis cynosuroides, has been traditionally used in herbal medicine for its renal benefits. It possesses anti-inflammatory properties and supports urinary tract health. Its phytochemicals may enhance kidney function and aid in flushing out harmful substances, further contributing to overall renal well-being. But whatever diet or medicinal treatment you follow, hydration is important.
So when someone says they don't drink water because they've got to go to the bathroom all day, I'd like to suggest it's because they're missing mineralized salts. And if someone says, but I drink water, my legs swell, all that water is extracellular, not intracellular. When that water is pulled inside the cell, there's a little motor inside the cell membrane, and when the water rushes through the membrane, it causes that little motor to spin, which gives us a unit of energy.
Even mild dehydration can lead to significant physiological disruptions. Dehydration has been linked to a range of health issues, including impaired cognitive function, decreased physical performance, and increased risk of kidney stones. O'Neill points out that water is essential for regulating body temperature, transporting nutrients, and removing waste, making it vital for metabolic processes. Chronic dehydration can cause conditions such as hypertension and diabetes, as insufficient fluid intake affects blood viscosity and insulin sensitivity. Furthermore, research shows that dehydration can trigger headaches and migraines, as well as contribute to mood disturbances like anxiety and depression, due to its impact on neurotransmitter function. O'Neill advises monitoring hydration levels, especially during physical activity or in hot environments, and suggests consuming foods with high water content, such as fruits and vegetables, to enhance hydration. Proper hydration is also crucial for skin health, joint lubrication, and maintaining electrolyte balance. That's why you need to cut off some major dehydrating agents from your life, like coffee. Dr. Barbara O'Neill highlights several hidden dangers associated with excessive coffee consumption, primarily emphasizing its caffeine content, which can lead to increased heart rate, anxiety, and insomnia. Consuming more than 400 milligrams of caffeine daily, equivalent to about 4 8-ounce cups of brewed coffee, can elevate the risk of heart palpitations and disrupt sleep patterns, adversely affecting overall health. Additionally, high caffeine intake can lead to digestive issues, including acid reflux and stomach irritation, due to its acidic nature. Caffeine dependency may develop, resulting in withdrawal symptoms such as headaches, fatigue, and irritability when consumption is reduced. Plus, excessive coffee consumption can interfere with nutrient absorption, particularly calcium and magnesium, increasing the risk of osteoporosis over time. The interaction of coffee with certain medications can cause side effects or reduce medication efficacy. Moreover, the habit of adding sugar and cream to coffee can also contribute to weight gain and metabolic disorders. Next, we'll move on to the significant role of the lymphatic system in overall health. It's essential for detoxification, immune function, and fluid balance. The lymphatic system transports lymph, a fluid containing white blood cells that fight infection throughout the body. Unlike the circulatory system, which has the heart to pump blood, the lymphatic system relies on muscle contractions and movement to propel lymph. Rebounding, or jumping on a mini trampoline, is a highly effective low-impact exercise that stimulates lymphatic flow through gravitational changes.
Also the rebounder, that little trampoline, the mini trampoline, it stimulates your lymphatic system. You know the health bounce is just this. If you're not used to rebounding, start with the health bounce, and as you get better at it, you can start going more. And what the rebounder does is it stimulates your lymphatic system, and your lymphatic system is your body's vacuum cleaner. So this program, your body's having a house clean. So if you can rebound, try and rebound about 3 minutes 3 times a day while you're here, and that will stimulate your lymphatic system. And as your lymphatic system sweeps waste away from the tissues, it'll be released out when you have your steam sauna.
This exercise enhances lymphatic circulation by promoting the contraction and relaxation of lymph vessels, effectively moving lymph fluid and flushing out toxins. Dr. O'Neill notes that rebounding can increase lymphatic drainage by up to 30%, helping reduce inflammation and boosting immune function. In addition, rebounding improves cardiovascular health, strengthens muscles, and enhances coordination and balance. Regular practice can lead to increased energy levels, improved digestion, and better overall metabolic health. Engaging in rebounding for as little as 10 minutes daily can yield substantial health benefits and promote longevity. Speaking of longevity and wellness, alkaline-forming foods are essential. They help combat disease and contribute to maintaining an optimal pH balance in the body. Lemons, despite their acidic taste, are highly alkaline-forming once metabolized, rich in vitamin C and antioxidants that bolster immune function, aid digestion, and promote detoxification by enhancing liver function. Dark green leafy vegetables such as kale, spinach, and collard greens are nutrient-dense, providing essential vitamins A, C, K, and folate, along with minerals like magnesium and calcium. These help regulate acidity levels and reduce inflammation, thus lowering the risk of chronic diseases. Additionally, these vegetables are high in fiber, supporting gut health and enhancing nutrient absorption. Specific nuts and seeds, including almonds, chia seeds, and flax seeds, are excellent sources of healthy fats, protein, and fiber, contributing to an alkaline environment while providing anti-inflammatory properties. Their high mineral content, particularly magnesium and potassium, aids in maintaining electrolyte balance and promoting cardiovascular health. But there's more to wellness. Dr. Barbara O'Neill highlights that nightshade vegetables, including tomatoes, potatoes, eggplants, and peppers, contain alkaloids, which can impact individuals differently based on genetic predisposition, gut health, and existing inflammatory conditions. For some, these alkaloids can cause symptoms of arthritis and other inflammatory diseases, while others may tolerate them without issue. O'Neill emphasizes the importance of individualized dietary approaches. Individuals with autoimmune disorders often report improvements by eliminating nightshades from their diets. The presence of solanine, particularly in green potatoes, can also contribute to gastrointestinal distress and increased inflammation in sensitive individuals. Dr. O'Neill suggests maintaining a food diary to track reactions to nightshades, as sensitivity can manifest as joint pain, digestive issues, or skin reactions. Additionally, she notes that cooking methods can alter the alkaloid levels in nightshades, with methods like boiling reducing solanine content. For those who tolerate nightshades, they offer nutritional benefits, including antioxidants and vitamins. On top of that, Dr. Barbara O'Neill raises significant concerns regarding modern wheat, emphasizing its genetic modification and how it differs markedly from ancient grains. Modern wheat, primarily a hybrid of Triticum aestivum, contains higher levels of gluten and a protein called gliadin, which can trigger inflammatory responses in sensitive individuals. This increased gluten content correlates with a rise in celiac disease and non-celiac gluten sensitivity, conditions that affect a substantial portion of the population. Moreover, the high glycemic index of modern wheat contributes to insulin resistance and type 2 diabetes, as it rapidly elevates blood sugar levels. The widespread use of glyphosate in wheat farming further compounds health risks, as this herbicide is linked to various chronic diseases, including cancer and gut dysbiosis. The refining process of modern wheat strips away essential nutrients, leaving a product that is low in fiber and high in empty calories, leading to obesity and metabolic disorders. Additionally, the rapid fermentation process used in bread making alters the bread's digestibility and nutritional profile, exacerbating digestive issues for many consumers. But with all these, a proper dietary balance is extremely important. A harmonious diet ratio should contain 80% alkaline-forming foods to 20% acid-forming foods. Alkaline foods, such as leafy greens, vegetables, fruits, nuts, and seeds, promote optimal pH levels in the body, supporting vital functions and enhancing energy levels. In contrast, acid-forming foods like processed meats, dairy, refined sugars, and grains can lead to an acidic environment, potentially resulting in inflammation, fatigue, and chronic health issues. Dr. O'Neill recommends incorporating a variety of alkaline foods into each meal, such as kale, spinach, avocados, and cucumbers, while minimizing intake of acidic options. When you apply this 80-20th rule, you can see an improvement in your overall health within weeks, enhancing digestion and supporting detoxification processes. Then comes a lifestyle revolution, which is basically a triad of dietary modifications, physical activity, and stress management to enhance healing processes. With a proper diet comes some specific nutrients, such as omega-3 fatty acids, antioxidants, and fiber, which play crucial roles in reducing chronic disease risks and promoting cellular repair. Plus, integrating regular exercise, aiming for at least 150 minutes of moderate aerobic activity weekly, improves cardiovascular health, boosts mood through endorphin release, and aids in weight management, which can reduce the risk of metabolic syndrome. Resistance training is particularly beneficial for preserving muscle mass and improving insulin sensitivity, further amplifying healing mechanisms. Simultaneously, effective stress management techniques, including mindfulness, meditation, and yoga, are vital for reducing cortisol levels. This can otherwise impair immune function and cause inflammation. Together, these lifestyle changes create a synergistic effect, maximizing the body's natural healing abilities and enhancing overall well-being. To explain all these, Dr. Barbara O'Neill shared a couple of success stories.
And I remember one day my daughter Emma was splitting kindling, and someone called out and the tomahawk went on her finger. So what do? Oh, we just cleaned it up. There's a bit of common sense there, isn't there? You know, common sense isn't very common today. Yeah, of course you've got to clean it up. Cleaned it up really well, pushed it together. Do you hear that? Pushed it together, put some comfrey cream on it, and then bound it up and made a splint and held it there.
But that's not just one. There was a patient with type 2 diabetes who adopted a whole food, plant-based diet. resulting in a significant reduction in blood glucose levels and the eventual elimination of insulin dependency. Another individual suffering from hypertension followed Dr. O'Neill's guidance, incorporating daily exercise and stress management techniques, leading to a 20-point drop in blood pressure within months. One remarkable case involved a woman with rheumatoid arthritis who shifted to an anti-inflammatory diet rich in omega-3 fatty acids and antioxidants, achieving substantial symptom relief and improved mobility. There was also a former heart disease patient who reduced cholesterol levels by over 50% through a combination of plant-based meals and regular cardiovascular workouts, ultimately avoiding surgery. Furthermore, she also talked about a man diagnosed with obesity-related sleep apnea who transformed his health by embracing a low-calorie, nutrient-dense regimen, resulting in weight loss of over 50 pounds and improved sleep quality. All these anecdotes emphasize the importance of a structured approach to empowerment for disease reversal and prevention, beginning with a comprehensive assessment of dietary habits, lifestyle choices, and health status. Implement the first step by tracking daily food intake and physical activity, identifying areas for improvement, and addressing any nutritional deficiencies. Next, prioritize a whole food, plant-based diet, rich in fruits, vegetables, whole grains, legumes, nuts, and seeds. Start doing regular exercise, alongside strength training exercises to enhance muscle mass and metabolism. Engage in stress-reducing practices such as mindfulness, meditation, or yoga to lower cortisol levels, improve mental health, and support immune function. Besides these, establish a supportive social network by surrounding yourself with like-minded individuals who encourage healthy habits and share similar goals. Lastly, educate yourself on health literacy, understanding medical conditions, and treatment options, empowering you to advocate for your health effectively. So, have you considered how your diet could impact your health? What changes are you thinking about making? Share your thoughts in the comments below, and don't forget to like and subscribe for more insights on health and wellness. And along with changing your diet, you also need to revamp your kitchen because most of our kitchens are full of silent killers. Curious to know more? Just click on this video.